My name is Dr. Jeremy Pollock. I'm a cardiologist at the Sandra R. Berman Heart Institute at the University of Maryland, St. Joseph's Medical Center. Congestive heart failure is a scary diagnosis for many patients, so it's important to understand what it is. So when we talk about congestive heart failure, the job of the heart is to pump blood forward. And when you have heart failure, the heart is having a difficult time moving blood forward. And there are two major reasons for that. The heart's either weakened, so it's having a weak problem where it can't pump blood forward, or it's stiff, S-T-I-F-F, so it can't fill well, so blood can't go forward. Either or results in the same thing, where you can't get enough blood to the organs that need it, your lungs, your brain, your kidneys, so you can start to feel poorly over time. Congestive heart failure can be caused by many different things. So depending on what causes it and what type of congestive heart failure you have, the onset can be very different. Some people experience it suddenly if they had a heart attack and then their heart is weakened. And some people experience it insidiously or slowly if it's due to chronic medical conditions. So there are very different reasons that can cause that to happen. The number one cause for patients to have congestive heart failure is also the number one killer in the country, which is heart disease. When we talk about heart disease, we mean plaque in the arteries of the heart, which slows down blood flow to the heart muscle itself. And if you don't get enough blood flow to your heart muscle, your heart over time will weaken. So the number one cause is heart disease. So you have to think of what are the reasons that people get heart disease in this country. So 1, 2, and 3 are being overweight, being inactive, and eating unhealthy. And when you're overweight, eat unhealthy, and don't exercise enough, you typically develop high blood pressure, high cholesterol, diabetes. Add on top of that smoking. So all these things can contribute to or cause congestive heart failure, typically from a heart attack or heart disease. Family history is really important because we can't control our genes, right? So knowing what your genetics look like, getting an insight into your family history, what did mom and dad have, what did brothers and sisters, your grandma have, is really important because there is usually or typically a genetic component that can predispose you to congestive heart failure. Even in the last 5 years, the therapies that exist now for patients with weakened hearts with congestive heart failure has exploded. We have so much more medicines and procedures that we can offer to these patients than we did 5 years ago. In the last 3 years, there are now 3 new medications that I can give to patients. There's a procedure that just came out a couple years ago that we can offer to patients. So the world of heart failure is ever changing. So again, really important to be at a center of excellence that is on the cutting edge, that can offer patients the best therapy possible, because we really can change a patient's trajectory and get their heart better, improve the function of the heart. So the Bridge Clinic provides an avenue for patients at risk with congestive heart failure to access that center of excellence. So we at the Bridge Clinic have a multidisciplinary care team that again focuses on the whole patient. Typically, a patient accesses the Bridge Clinic when they've been hospitalized with congestive heart failure, whether that's a first episode of congestive heart failure or a subsequent episode of congestive heart failure. It's hard when you leave the hospital. That's a really dangerous time for patients. It's confusing. They've gotten a lot of information in the hospital. They're new or different medications. And it's difficult to find your cardiologist, your primary care physician, and get an appointment quickly. And we've shown if we can see patients quickly after a hospitalization, think of it as a bridge to your provider. Think about it as a continuation of the hospital care. That's what we do at the Bridge Clinic. We're continuing what happened in the hospital so that we can lower your risk of going back to the hospital, getting re-hospitalized, and then we can increase your chance of getting on the best medications possible. So we tend to, and we try to, our goal is to see patients within 7 days, 7 calendar days of being discharged from the hospital. Many of the patients that we see in the Bridge Clinic are after hospitalization for heart failure, but there is a contingent, there's a group of patients who are in the community who are at risk of getting hospitalized or have been given a new diagnosis of heart failure. So that's a group of patients we also see because you don't want to be hospitalized. It's not a good thing for the patients or your family. So we're able to spend a full hour with the patients multiple times in a row, multiple weeks in a row. Again, no different than once they leave the hospital. Now we can educate the patient about their new diagnosis. We can provide them an opportunity to get on the best therapies over time. We can give them more touch points, more ability to be seen by different multidisciplinary providers to give them the best shot to get better. University of Maryland St. Joseph's is the premier comprehensive cardiac center in Maryland. If it was me or someone I love, this is where I would get taken care of. We do hearts very well, and we have physicians and providers in multiple different specialties within the world of cardiology. It's a place where cardiology is a center of excellence here, and this is what we pride ourselves in doing and providing that opportunity for patients in our community.